to answer the million-dollar question that, Doctor, when can we get our teeth clean? So it depends on a variety of factors. How well are you brushing? The first and foremost thing for maintaining hygiene is at your home. You must brush properly. We have different types of brush. You always use a soft brush and usually change your brushes every 3 to 4 months so that the bristles they don't fray, they don't lose their shape. Second thing is that you must use a mouthwash. Mouthwash usually helps to keep your breath away, bad breath away, and also tends to remove bacteria from the places where our tooth can't reach. The newest technology is a water pick or a water gun, where we can use it to remove the debris in between our teeth. So once you have been maintaining your hygiene well at home, then you can visit your dentist because there are certain areas where back of the teeth and lower areas of the teeth where our brushing can't be that effective. So in these areas, your dentist will use a prophylaxis or a scaler to remove all the calculus and the debris and keep your teeth maintained in a sparkling white condition. So if you're smoking or if you consume more of coffee or tea, usually you have to get oral prophylaxis done every 3 to 4 months. But if you don't have any bad habits, means you're not smoking, so you can get it done every 6 months. And don't worry, the scaling won't spoil your teeth, as being a misnomer or a misconception that people thought scaling damages your teeth. But no, that's not right. Instead, not doing the scaling can damage your teeth in the long run because the plaque and calculus will develop and further degrade your teeth and eat into your bone, and sometimes may even lead to a loss of teeth, which is more expensive and painful to replace. Thank you.